Spend a medical minute with Kaleida Health.
I think seeing a primary care provider and a healthcare provider yearly is important for a number of reasons. One is there's the routine screenings one should have, cancer screenings, prostate screening, colorectal screening, but then there's other chronic illnesses that should be screened for. I also think we should be thinking about other screening. Where's your ophthalmologic health or eye health? Where's your dental health? Are you getting the right vaccinations? Making sure that if you're taking medications or supplements that this is assessed annually to make sure that it's the right combination, or should you even be on these items and at what doses? You need to find someone who will provide you access in a reasonable timeline. Kaleida and general physician, we have ability to schedule appointments. We have access lines. We have teams that help arrange that. We believe that you should get the right care at the right place at the right time. And it's critical. Maintaining your health is a really huge part of your quality of life.